Well, I'm Dr. Enda Devitt. I'm primarily a GP, but I've been working with Galway senior footballers now. This will be my 9th season. So I would have had a specific interest in the area of concussion and its management, and would have, initially wanted to start to approach it in a more objective fashion, which led me to the use of impact initially, and then on to my association with the UPMC Concussion Network, which was started in June of last year, which has been a very useful tool as a collaboration amongst other physicians and rehab specialists. So it allows us to approach each case and make good objective decisions on, okay, what's driving this patient's symptoms, how can we approach it to help rehabilitate symptoms if they've got vestibular dysfunction, ocular dysfunction, but also to make safer decisions on when, be it players returning to play, and still working within graded return to play protocols, but also allows us to, see people who have long-lasting symptoms that I think, historically we've been just observing this injury and waiting for it to recover spontaneously, or hoping for it to recover spontaneously. But what we're seeing is, if you start to break this down into its component parts, there are areas we can rehabilitate and get these patients better. We use impact, which is a neurocognitive or computerized neurocognitive assessment tool. So it allows us to get good objective data on what that player is like prior to sustaining a concussion. So it breaks it down into verbal memory, visual memory, reaction times, visual motor speed. So it gives us good reliable data that then, in the event of that player sustaining a concussion, we can then retest them and be able to objectively determine that they've fully recovered before we consider returning them to contact. And because otherwise, in a lot of cases, players want to be back on the pitch. We're relying in a lot of circumstances on their subjective reporting of symptoms, and probably returning players to play too soon by that being the case. So this allows us to improve the standards of when we return players to play. And there are good independent research studies looking at the specificity and the sensitivity of that as an assessment tool. But again, we need to remember it is one tool within the overall management of concussion, and it's not intended to replace a good clinical history and evaluation of the patient. So, but it can, in my opinion, it can dramatically improve how you do manage it. We need to change the culture around the injury, as we know more about it, we need to get that knowledge across to, coaches, parents, players at all ages, and we need to, have this message get across from a very young age, because there's a lot of, we need to, it is a brain injury. We need to treat it with respect, but treat it with proper knowledge that, we respect the injury and not fear it.